Thank you very much. I want to start with our numbers. We don't have updated numbers, so these numbers have been reported widely. But for folks that might have missed it, as of yesterday, there's 197 cases of COVID-19 in Boston, 1,159 statewide. 21 people in Boston have made full recoveries. We have lost two people. Two people passed away due to COVID-19 in Boston, and we've lost 11 people statewide. Our thoughts and prayers are with those families. Each loss reminds us of why and what we're doing to slow the spread of this virus down. Every single step that we take is to prevent illness and loss of life. It's to give our medical community the time and the capacity that they need to do life-saving work, to support our vulnerable populations, and to get our city through this crisis. I want to be absolutely clear about the focus. We heard yesterday some mixed messages, last couple of days actually, mixed messages from Washington and the national conversation to suggest that we shift priorities. Our focus in Boston and what should be in the country right now is on public health. It's to listening to our medical community. It's about doing the right thing now and in the difficult weeks ahead. Our focus should be on saving lives, preventing the spread of the virus, because every single life is worth saving. I also want to be clear, there's no other options. If our health system gets overwhelmed, there will be serious implications to this. There is no economic recovery without public health, and there's only one way through all of this, and that's to test our resolve, and Boston certainly has what it takes. Over the last couple of weeks, we've taken time to shut our schools and libraries and cancel events. That's why non-essential industries are physically closed. That's why I ordered construction to pause, and it will remain paused until the city of Boston restarts it. We will be releasing some guidelines when work does return on what will be expected in the city of Boston as far as construction guidelines. That's why yesterday the governor issued a stay-at-home advisory. Everyone who can stay at home, we're asking you to stay at home. You should stay there, except to go out and pick up essential items, or maybe take a walk for mental health break to be able to get some air outside of your house. We're asking people to continue to stay 6 feet away, practice social, physical distancing. We're asking people to continue to wash your hands and sanitize your hands throughout the day with soap and warm water, or use hand sanitizer. We're asking you to keep all surfaces clean and disinfected. That means doorknobs in your car, if you go out in your car knobs, and making sure that as you go out, if you can wear gloves, just because we want to keep you safe. We know that this isn't easy, particularly physical distancing is very hard, and the economic impacts are hard, but it's an all-hands-on-deck approach. And we're going to continue to support the people of Boston and the businesses of Boston, and we're going to continue to support each other through these very difficult times. We are working around the clock to help the most vulnerable, our seniors, our low-income families, our homeless population, our kids, all of our neighbors. That's why we hired the McChrystal Group to work to analyze our plans and strengthen our protocols. I spoke to General McChrystal yesterday, and we're getting input every single day and seeing what we've done and the plans we've put in place and how do we continue to move forward. We're preparing for whatever it takes, and I have some updates today on some of our responses. The Boston Resiliency Fund has surpassed its initial $20 million target in a little over a week of fundraising. We're still accepting donation, and that's an incredible testament to our community. We're already using these funds to buy thousands of Chromebooks. We now have over 18,000 of those laptops in our students' hands, and we continue to distribute those laptops to our kids in Boston. We are releasing $5 million in grants to the following organizations that serve very vital needs. They include senior and low-income food providers. The Greater Boston Food Bank, that supplies and supports food pantries across the region. Ethos, which delivers Meals on Wheels to 8,000 seniors. This will allow it to serve more people. Fresh Truck, which will work with partners to deliver fresh produce and household needs. Community Servings, that provides healthy meals to critically ill people and their families. Project Bread, their food source hotline, is a statewide resource for people looking for food resources, and the demand is extremely high. The grants and funds are also supporting health care for vulnerable populations. Boston's Health Care for the Homeless is screening and testing and operating its new medical tents that we created next to our shelters. The Boston Medical Center will use the grants to care for patients, support staff, and sustain safe hospital operations. And Pine Street Inn will increase cleaning of their facilities and work with the Boston Public Health Commission to staff quarantine sites for the homeless. I want to take a minute to thank the steering committee and all the donors. We're going to keep the fund growing, and 100% of the money will continue to serve these kinds of needs. For more information on donating or applying for funds, please visit boston.gov/coronavirus. And to be clear, if you're applying for this money is going to meet the needs that are assessed right now today in combating the coronavirus. For our small businesses, yesterday I signed an order lifting the City of Boston's ban on plastic bags during this emergency. Right now, we're allowing and helping restaurants and essential stores to provide takeouts and deliveries, and we worked with the state on passing legislation up there to lift the beer and wine restrictions, is allowing people when they order takeout to have that option. That has not passed legislature yet, but I want to thank the legislators who are working on that. Our businesses need flexibility right now to serve their customers. So restaurants, pharmacies, and other essential stores can offer paper and plastic bags no charge to customers. So we're going to do everything we can in the immediate right now to help our businesses to be successful and to keep them open, and we're going to continue to working with them. We're also working on a range of additional supports for our local businesses. I want to remind everyone you can find directories of open restaurant and businesses at boston.gov/coronavirus in the local resource section. I encourage businesses to sign up, and I ask residents, if you're looking to get food delivery to your house, make those calls, go on that guide. These are businesses that need the help, and if you're going to do takeout, you could look around the city to see what's available. I'm also asking people to check our guidebook for businesses to see how they can use delivery services for workers to get hired in food delivery right now. So we're working to connect opportunities with these businesses as well. For our students, that I already mentioned, we have over 18,000 Chromebooks in the hands of students. We have over 70 meal sites continue to operate across our city. I've heard from BPS that some of our immigrant families are concerned about going out under the stay-at-home advisory. I want to reassure them that it's safe to visit these sites, and people who are supporting you also want to help you. We continue to get amazing support from volunteers and community members. One of our nonprofit partners that has stepped up in a big way is Katie's Closet. They've supplied 500 toiletry packages to each of our 16 BPS emergency meal sites. That includes feminine products we provide free in school for girls and young women. We're also working to continue the wraparound care that our schools provide. For medical personnel, I want to just start by saying a huge debt of gratitude and thank you for the incredible and difficult work that you're doing every single day, and to your families for supporting all of us. The same goes for our first responders, our Boston Police, Boston Fire, and Boston EMS, the custodial staff that keeps our buildings clean and safe, the grocers and pharmacy workers, the transportation and public work employees. I want to thank everyone on the front lines of this crisis. It's never been more clear in our lives that we live with heroes all around us here in Boston, and quite honestly, I can expand that to the Commonwealth of Massachusetts too. So thank you all the first responders throughout the Commonwealth. Transportation supports are in effect for hospital workers. We have discounted rates in commercial parking garages. The garages are listed on our website, so you can get the access code from your hospital for your work, or you can contact your hospital as well. Blue Bikes we've made free monthly passes for hospital staff. We're reopening stations that were closed for the winter, and the bikes are being disinfected regularly. But I still ask you, if you take a Blue Bike, my suggestion is you wear a pair of gloves when you're riding it. Even though we're cleaning them, you just don't know to be safe. And starting today, the MBTA is adjusting commuter rail schedules to get more trains into Boston for the 7 a.m. shift. For emergency workers with young children, we now have 27 emergency child care centers operating in the city of Boston. They are for workers in healthcare, public safety, and essential industries. You can find them listed at boston.gov/coronavirus. Some updates on getting trusted information, and this is probably the best way to get your information, other than, as I said yesterday, watching it on the news or getting it from one of our papers. You can we have text message alerts going out daily in 6 different languages. That number is 99411, and text the message Boss COVID. The word Boss COVID, text it to 99411. You can also find codes to receive messages in other languages. We have information on 10 languages available on boston.gov/coronavirus. Let me be very clear. I kind of said that too quickly. We have 6 languages on our text messages, and we have 10 languages available on boss.gov/COVID, so people can get that information that you need. Today, we launched another new information service in the form of our COVID-19 dashboards. They are a visual toolkit that tracks the growth of cases and testing and other key information. They are linked with our website, so anyone that wants to find information, you can go to your website, go to the cityofboston.com website, and you can put in COVID-19 and the dashboards will be there. I'll conclude with some reminders. City Hall is operational, but we are discouraging visitors. Most of our services are now online, and if you need to come into City Hall, we're asking you to call 311 to set up an appointment before you come in. Please follow the Boston Public Health Commission's guidelines on what to do if you experience symptoms. Don't go straight to the hospital or doctor's office. We're asking you, first of all, isolate yourself, call your doctor, your primary care, or call 311 and we'll hook you up with the Boston Public Health Commission. Mental health has certainly been a concern for many people right now, so we're asking people to be kind to yourself and your loved ones. Get fresh air, stay safe, exercise. Make sure you reach out to folks through phone, through FaceTime, through texting, just to check in on people to see how they're doing. And if anyone feels vulnerable or scared right now and doesn't know where to turn, you can call 311 in the city of Boston, and we'll hook you up with somebody to talk to if you need that help. It's an important time that you take care of yourself, and if you feel alone or scared, please call 311, because there's a whole bunch of people in the city of Boston that are here that love you and care for you and want you to be safe and want you to know that we're right behind you. All of these calls are anonymous counseling, by the way, so when you call, anonymous counseling on the phones. We're here for you. We're grateful for all that you're doing and sacrificing people in this terrible time that we're going through. We're going to get through this together, one day at a time, as one great city. I just want to, before I take questions, I wanted to say a couple more thank yous. I want to thank our senators and congressional delegation. There's a relief package that's working its way through the Congress right now in Washington, and there's some stuff in there that's going to deal with small businesses, with unemployment insurance, with a whole host of different issues. So I thank our delegation. The bill's not been finalized yet, but it's working through, so I want to thank them for their efforts in this, and hopefully that will be done pretty soon. And also I'd like to thank our state representatives and state senators at the State House who are working with the governor as well in putting another package of legislation through. We're still somewhat in the early days of the coronavirus, so there's a lot of questions, a lot of unanswered questions about unemployment and about small businesses, about large businesses, about what we're going to do here. And over the course of the next days and weeks and months ahead, we'll be working on all these, but I'm asking for your patience right now as we move forward. With that, I'd like to open up for any questions.
Mayor, you talked a little bit about the MBTA starting to have more buses or trains running in the morning for essential employees. We recently heard that 3 workers were diagnosed with coronavirus. Is that a concern to know that the people who are on these trains and buses are essential workers having contact?
You'd have to, on that one, I'd ask you to contact MBTA, because I don't know enough about it to give you a well-informed answer on that. So I'd ask you to talk, because I'm not sure what the situation was, if they were driving or not driving. I don't want to give false information.
You mentioned the stay-at-home advisory that the governor has issued. Some Massachusetts towns, like Martha's Vineyard, they're going ahead with shelter-in-place order. Is that something that the city of Boston would consider doing, or leaving the state?
Well, I think at this point we want to get as many people disciplined to the shelter in place, and if we don't have to take the next step, if people just abide to the rules of going out just for essential products and staying in the home, we could see our numbers change and see that curve at some point. But we are certainly not ruling anything out in the city of Boston, and one of the things the McChrystal Group is doing for us is preparing us in the inevitability potentially of shutting down the entire city. But I think at this point right now, I can't be clearer. I mean, people need to understand the importance of sheltering in place, staying at home. We can literally almost stop the spread if people do that disciplined enough and don't go out to other folks and don't interact with other people. And I think we'll make decisions based off what the numbers look like. I think we're anticipating over the next several days to see a large increase in our numbers, both here in the city of Boston and the Commonwealth. And then hopefully we start to see the curve kind of level out, but it's still too early to say that.
Follow-up, how is the city of Boston enforcing the governor's order, especially for the non-essential businesses?
mean, I'm trying to, thank you. The question is, sorry, I should have done that earlier. How are we enforcing the governor's stay-at-home order advisory? We're trying to get as much information out to people and overload them with information to let them know the importance of it. I think anyone that quite doesn't understand it, I'd suggest you turn on the national news and you listen to what Governor Cuomo's saying in New York City and how he's talking about, he's basically telling us a roadmap on how to prevent what New York's going through, whether it's on the numbers of cases that are increasing or the medical supplies that are needed. And he's been very clear on that, saying other cities and towns should follow to look and see where we are today and try and prevent that from happening. And I don't know if you can get any more clear than that. And I think that if people decide not to listen to the stay-at-home advisory, what they're going to do is put an overburden on our hospital medical facilities where we're not going to be able to keep up with capacity. People will die. More people will get infected. And I think that we have to do everything we can to prevent that from happening. And it's incumbent upon each and every one of us as Bostonians, as people from Massachusetts, as Americans, to follow the guidelines. I mean, we're looking in different countries. Hong Kong was able to seem to capture in the very beginning the shelter in place and kind of spear off the rise in coronavirus, and then everyone came out again, and now we're seeing spikes in Hong Kong. So I think we'll watch what happened around the country and around the world, and the best practice is to stay at home.
On that, hospitals being overloaded. I know that city and state is looking into dormitories and other places around the area that if the hospitals have too many, set up beds. Has that been done yet?
Yeah, well, the city of Boston, we put together a list about a week and a half ago, and we shared it with the state on potential overflow for whether it's hospitals or medical personnel. We're using it. Going to use some of it for our homeless population. We're looking at it there, and then also we gave them some other sites. I think what Governor Cuomo did in New York by using the convention center, I think that should be an option. I think there's a lot of opportunities for us here in the city of Boston, and I know there's conversations happening right now. Our governor mentioned on Sunday a call with the Army Corps of Engineers, and one of the reasons they were on the call was to look at these sites where we could build capacity for hospitals. So unfortunately, we're going to have to build it. Hopefully, we'll never have to use it. I'm hoping, though, that it's going to be up quickly so we're prepared if the numbers spike.
Mayor, we've gotten a lot of calls from people who are concerned about these essential workers and ETA staff, postal carriers being exposed while they're doing their jobs. Are you concerned about that?
Yeah, I mean, that's one, and I didn't mention those folks, and I should have in the very beginning. They're our frontline staff, and I want to thank them for what they're doing. We have to try and do everything we can to keep them healthy. I think that trying to get some supplies if they need them, if they want them, is important, and also let them do their job and don't bother them. Meaning that if your post person is delivering mail, thank them from afar. If somebody's driving an MTA bus, don't crowd the driver. Give the driver the space. Let the driver have the space that they need to be safe. I think it's really important that we keep them safe and healthy.
Mayor, there's a rent and mortgage moratorium that's being discussed right now at the City Council meeting. I'm not sure if that will be brought up for a vote. Can you speak on that?
Oh, yeah. I spoke to the question is the City Council is having conversations about the rent and mortgage moratorium right now, and that's something that on our call this morning with the City Council was talked about, and I think that's something that's really important for us as we move forward here. There's a lot of tenants and a lot of landlords that are struggling right now, and I think that's something something we need to have more than a conversation about and some action on. As I mentioned, I think the last time I spoke here, some of the banks are coming out with products to not forgive the loans, but kind of put the mortgage payments on the back end of the loan without fees and penalties. So one of the suggestions I'd make anyone who's out there, a landlord or tenants that have issues with credit cards or mortgage payments, things like that, make sure you call your bank, because a lot of it you need to see what your banks are offering. A lot of them are offering products right now because they understand this as well. And I don't think banks are in the business of wanting to take people's homes from them. And I think if they can keep people in their home and defer those payments to the back end of the mortgage is something that's important. And I'd encourage banks that aren't doing that to come up with some products on that. At some point, I'm intending on having a call with the different financial institutions in the city. No, I don't have any information on it. You honestly have to go to the T. I don't want to give false information. I don't have that. If I had it, I'd give it to you.
Mayor, what are your thoughts on the partisan debate outside of the stimulus package? And can you speak to the need for it to be passed here in Boston?
Yeah, I mean, I think that, in this particular case, the coronavirus, like a lot of things, it's not Democrat or Republican. this is an American problem that we have right now, and it's a worldwide problem, pandemic. And I think that we just need to not get caught up in the partisan politics. And I think that it's very important that the messaging is consistent and we work together in this. A lot of people are afraid, and the last thing that they need to do is have people being publicly criticizing each other. If they want to have conversations and disagreements behind the scenes, that's fine, or even on the floor. But I think it's really important that this moves forward, that we get this legislation through. I think this is, there's going to be plenty of time to be critical of each other when this is over. But right now is not a time for that, in my opinion, on any level. I think that for the most part here in Boston, 100% unanimously, we all disagree on something, and I think it's important for us to have a solid message moving forward in unity and get our disagreements and put them behind us and move forward, because there's far greater risk in front of us.
Yeah, I'm hearing from a lot of other cities and towns, especially with regard to homeless shelters. They're waiting for, I think, MEMA to announce some sort of plan for extra capacity. I know the city of Boston moved ahead on its own, but do you have concerns about your capacity? Do you have a sense of where the state is on this?
Yeah, I mean, I think that I can't answer for the state. I know they're working on some stuff, but obviously Boston, we have the ability to create capacity right now and to kind of help isolate people that might come down with symptoms of the coronavirus, and also keep people separate. I was on a call the other day with a couple of mayors, and they don't have the same capacity we have, so they're really reliant on federal government guidelines and some support, as well as state guidelines support. And I offered on the call, as best I can, if we can assist any other city in town on a plan in any way, we'll be there for them. We're fortunate in Boston to have an incredible network of folks working on this, but we're going to try and continue to help other cities and towns if they need the capacity. Yeah.
Regarding this filed a lawsuit yesterday, they said they've been driving around, they're independent contractors, and they're not able to get unemployment. After picking up people from biogen contracts from the airport, they said they've still been driving around. They're not able to stop working. What should people like that do?
Well, I think, first of all, they should contact the congressional delegation, because I think there's a provision in the bill that's going through Congress that would address some unemployment insurance for independent contractors. And I don't know if they're deemed that way. I think they should reach out to the congressional delegation. I think, number one, that's something that I would do. And secondly, one of the concerns that I had on a call today, completely separate than that, was making sure that these drivers, every time they pick somebody up or pick up a food delivery, that they sanitize their vehicle. And that's something that, that's not under our purview in the city of Boston. We don't have that ability. If we did, I would do it. But making sure they sanitize every time they pick somebody up. So that's a separate issue than what you asked me. But I would suggest they contact the federal government, and we'll look into it as well after the question. Any last questions?
Just ask Chief Martinez.
Yes.
I wanted to ask you about those reusable bags and the concern surrounding that.
Oh, reusable bags?
Yeah. So on the reusable bag piece, there isn't really a concern. Obviously, when people are coming into stores and coming into facilities, it's important that folks think about their own health if they're sick, and then they're not transporting anything that could infect others. So again, the reusable bags, there isn't a fear that those reusable bags that people are bringing with them could carry the coronavirus with them. Again, we want people to only go in if they need to get an essential service, but there isn't that fear related to that specifically.
I mean, we lifted the ban because in some cases we're hearing that they're running out of bags. In other cases we're hearing that people are worried about taking reusable bags. And right now at this point it's just about people that are going shopping, being able to get their produce and go home. And I think that, it's a short period of time we're lifting it for. At some point, when we hopefully get back to normal here sometime in the future, near future, it'll go back into effect. It's just it's the ability to get people in and out of the stores as quickly as possible.
Thank you.
All right. Thanks, everybody.